Welcome to our NCLEX Masterclass. Today, we're going to break down exactly how to care for hospitalized kids by really understanding their unique developmental stage. This is stuff you absolutely have to know, not just for the exam, but for your whole career.
Okay, let's dive right in. Everything we're going to cover today is built on two huge concepts for the NCLEX. Development, how a child thinks and grows, and family dynamics. Now, that second one is so important. Remember, when you're caring for a child, you're really caring for their entire family. We're going to see how this plays out in every single stage.
So here's our game plan. We'll start with the little ones and work our way up through the teenage years, hitting the key stressors and what to do for each group. And then to make sure it all sticks, we'll wrap up with some practice questions. Let's do this.
First up, infants and toddlers. For this age group, the absolute number one stressor of being in a hospital is separation anxiety. This is their entire world, and getting a handle on it is totally key to giving them the best care.
Now, this anxiety isn't just one feeling. It actually progresses through three very distinct and very testable stages. First, you've got protest. This is the loud part, right? Crying, screaming, fighting. If that separation keeps going, the child can slip into despair. They get quiet, withdrawn, and might even lose skills they just learned. But the final stage, detachment, is the one we really worry about. And here is a huge NCLEX must-know. Detachment is the most serious stage. Why? Because the child might actually look like they're doing better. They might be playing, interacting a little, but it's a defense mechanism. They're basically giving up on the parent returning, and reversing the damage from that is incredibly, incredibly difficult.
So what's our plan? How do we fight this anxiety? Our nursing blueprint here is all about bringing back a sense of normal. See the pattern? We give them some control back with simple choices. We stick to their home schedule as much as possible. And we understand that regressing, like forgetting potty training, is a totally normal response to stress. For these little guys, consistency and comfort are your best medicine.
All right, moving on to preschoolers. As kids get a little older, their minds work in new ways, and that means their fears change too. For this group, the main stressor isn't so much about being separated from mom and dad, it's about what's happening to their own bodies. A preschooler's greatest fear is bodily injury. They don't really get body integrity yet, so a tiny little needle can feel like a major attack. And here's another critical piece, magical thinking. They might actually believe they got sick because they did something bad. So our blueprint has to address this. We provide security by having parents stay, and we demystify what's happening with simple, honest explanations and a whole lot of therapeutic play. Now let's talk about our school-age kids. At this point, their world has gotten so much bigger. It's not just about family anymore. It's about school, friends, and feeling accomplished. Being in the hospital threatens all of that. You can see their fears are more social and, cognitive. They're worried about falling behind in class or that their friends are going to forget about them. They also really need to feel independent and in control. So what we do has to empower them. We get them involved in their own care, give them tasks, and answer all their why questions with things like diagrams and videos. And that brings us to adolescence. This group is all about figuring out who they are. And when they're hospitalized, there's this huge internal conflict, right? They need their parents' support, but they're also fighting for independence and to just feel normal. The number one thing to get here is that for a teenager, their social world and their body image are everything. The fear of being different is overwhelming, so our care has to protect their dignity. That means privacy, privacy, privacy. It means encouraging them to text or call their friends, and it means helping them maintain their appearance by wearing their own clothes and keeping up with their grooming routines. Okay, we're going to shift gears now to a really important and sensitive topic that applies to all of these age groups, providing end-of-life care. On the NCLEX, you've got to show that you can be both compassionate and clinically on top of your game.
For the exam, you absolutely have to know the difference between these two. Palliative care is all about managing symptoms to improve quality of life, and it can happen at any point during a serious illness. Hospice care, on the other hand, is a specific type of care for when a patient is in the final phase of an incurable disease. The focus shifts entirely to comfort and support. As the body begins to slow down, you're going to see very specific physical changes. You need to be able to spot them. A huge one is Cheyne-Stokes respirations, that really distinct pattern where they breathe super deep and fast and then stop breathing altogether for a bit and then repeat. It's a classic sign that death is near. Okay, you've soaked up all the core concepts. Now for the fun part. Let's lock in that knowledge and put it to the test with a few NCLEX-style questions.
All right, first one up. We've got a 4-year-old, so that's a preschooler. Think back to what we just said about their primary fears. What's the best thing you can do here? Go ahead and pause if you need a second to think it over.
The best answer is to encourage the parents to stay. Now you might be thinking, but wait, I thought their biggest fear was bodily harm? And it is, but the hospital is a scary place. Having a parent there constantly is the single most powerful way to give them the security they need to cope with all those other fears.
Okay, next question. Focus in on the patient, a toddler, and look at those key behaviors: withdrawn, uninterested, and, this is a big clue, losing skills. Which of those 3 stages of separation anxiety does that sound like?
Yup, that is textbook despair. The loud, active fighting from the protest phase is over, and now the child has kind of sunk into this quiet, depressive state. Spotting this is so crucial so we can step in and help. All right, last question, and it's a pure fundamentals check. You have got to know your pediatric vital signs for the NCLEX. They will test you on it for sure. So, what's a normal apical heart rate for a toddler?
The correct answer here is B, 100 beats per minute. For a toddler, that normal range, that sweet spot, is between 80 and 120. So 65 is too slow, 140 is too fast. You've just got to have those ranges memorized cold.
And this really brings us to our big takeaway, which is really a question for you to think about. How will you balance a child's emotional needs with their physical ones? Because here's the thing, managing their medical condition is only half the battle. As you get ready for the NCLEX and for your career, always remember that meeting a child's developmental and emotional needs is every bit as critical to their healing as any medication you will ever give them.